Well, welcome everyone to our Zoom health fair. We are so excited to have two nurses with us. We have Miss Vanessa Enriquez. She is a registered nurse and she is the Health Services Administrator for MTC, that's Management Training Corporation. Her director, who's also a registered nurse, is Miss Tanya Reynolds, and she's joining us as well. Ladies, thank you so much for joining us on this Zoom call.
Sure, it's a pleasure.
Yeah, well, as I mentioned to you, I serve as a resident services coordinator, and every month we do health and nutrition and activities and health fairs where we try to get professionals such as yourself to answer questions, to help residents with any questions that they may have. And of course, we're battling COVID-19 in this pandemic, and so it is the topic at hand. So I thought a great question to start off with, maybe that here in Texas, a lot of our businesses are starting to open back up. There's a lot more social interaction than we've had in the past few months. And so with that can come a lot of questions like, is it safe for me to get out of my house? If so, what do I need to do? And so I thought I would just start with, maybe we can just start with, what are some guidelines in regards to how to start getting out and what precautions we still need to make, and maybe if there's even some silly things that we don't need to do, maybe you could address those too, but maybe you can speak to that for us.
For sure. So definitely with us being isolated for a while, our mental health is utmost importance. So everyone does need to start getting out, but the only thing precaution wise, just wear a mask. That's the main thing. If you have a mask with a filter, that's the best type of mask that you can use. But even a regular surgical mask or a cloth mask, that's sufficient also. It's best for you to wear a mask at all times whenever you're in contact with someone, and just maintain social distancing with 6 feet apart from people.
Awesome. This may be something that everybody knows by now, but what's so special about 6 feet?
6 feet, the droplets. So say I have coronavirus and Miss Reynolds is next to me and I cough and my droplets linger and she walks by, they usually drop within the 6 feet. And so if she came behind me 6 feet away, my droplets wouldn't be able to get on her and she wouldn't get infected.
That makes sense.
It's kind of like you stay in your bubble, I'll stay in my bubble.
Yes.
Absolutely. I saw a meme of a guy at Walmart that had a hat with some pool noodles.
Yes.
I haven't done that yet, but that's a good idea. So that's great. So another question that I have is, I was just speaking with a coworker earlier today, and I think everyone is like, man, I got sick earlier this year, and I think I had COVID-19. So yep. I know probably some of us maybe did, and a lot of us probably didn't, but at what point would you recommend someone try to get an antibody test? Or maybe even, maybe they've got a cough or whatever. At what point, what would you tell us and direct us about testing?
For sure. So it's allergen season right now. So everyone's going to be sneezing and coughing. That's pretty common. But the main symptoms are fever over 99 degrees. It can be as little as 99. So a fever, a cough that is dry and persistent, and shortness of breath. So if you have 2 of the 3 symptoms, you should probably get tested. So there's 2 different types of testing, a nasal swab, or they go into the mouth and they swab. And then there's also the antibody testing, which is blood test. So the antibody testing, you would have to have coronavirus and either be recovered from it already to have an antibody that shows that your body is going to be fighting it off. Or there's 2 antibodies that test positive on the blood test, the serum. The first one is if you're recovered, like I said, and the second one is if you are in the butt end of the stage of the infectious stage. So say it's usually a 14-day incubation period of how long you would be sick. So you would have to be in day 10 to 14 to show any of the antibodies, period. So the swab is the one that'll show that you're actually active and in early phases. If you do an antibody test, it's going to be pretty much you're recovering from it and you're not even contagious anymore. So.
Okay, good. How important is it if you did feel like you had flu-like symptoms or symptoms that, you know, maybe are as described? How important is it to try to go get an antibody test? Is that something?
So it's going to be important for you to get the swab for sure. If you have flu-like symptoms, it is very important, especially if you're elderly or if you have any kind of comorbidity such as like diabetes, high blood pressure, asthma, things like that, because when coronavirus hits their body, it hits it in a different way versus hitting someone that's healthy like me or Tanya. So if you have flu-like symptoms, seek medical attention to see if they expect you to get swabbed. And they have drive-throughs where they can swab you or whatnot, and they're pretty safe. So.
Okay, great. Man, is there anything else as far as just really another, I was going to say as far as just recommendations for good health practices, and maybe I'll say a lot of the residents that we serve are in apartment communities and live close to a large number of people. So in regards to that, you know, what recommendations would you give to those residents as far as just good health practices for COVID and even past COVID?
Okay, so the main thing is wash your hands.
Definitely.
Whether it be sanitizer or not, use your sanitizer as much as you can, but wash your hands with soap and water for at least 40 seconds. That'll clear any kind of germs or anything like that. Whenever you come back in from outside of places, it's best for you to blow your nose also, because if you are out and you have germs that get inside of your nasal area, you have hairs that trap them. And if you blow the germs out, it's less likely that you get infected by something versus them staying stagnant in your nose and then starting to breathe them.
Okay. Well, man, what a great wealth of information. Is there anything else you need to share with us?
I think we're good. Are you good, Tanya?
I think so. Yeah, wear your mask, wash your hands, social distancing. Yes. You know, if you feel like you're getting sick, and just to ease your mind, a lot of people, you know, how your mind can play tricks. Go ahead and call your healthcare professional, you know, and talk to them and see what they think. If they recommended you come in, get checked out, be tested, you know.
Awesome. Okay. Well, thank you so much. I really can't thank you enough for joining on here, and we really appreciate it. Appreciate all that you do for your community and for helping us kind of answer some important questions for ours. Have a great day.
Yeah, you too. Thank you.
Thank you, Vanessa. Thank you, Tanya.
You're welcome. Thank you.